India is still recovering from a dwindling second wave of COVID-19 infections. It may only have a few months more before a third wave threatens to completely overwhelm the country's healthcare system. A snap survey of 40 doctors, scientists, virologists from around the world has revealed that India will likely be hit by a third wave of COVID-19 infections in October. While the survey says it will be better controlled this time around, the pandemic will still continue to remain a public health threat for at least another year. However, over 70% of the experts consulted said any new outbreak would be better controlled since vaccinations would provide some measure of immunity. So far, India has only fully vaccinated about 5% of its estimated eligible population of 950 million. While experts feel its vaccination drive is likely to pick up, they have also cautioned against lifting restrictions early. In fact, most Indian states have eased restrictions in the past week as daily infections decreased. States like Maharashtra and the national capital as well turning their focus towards preparing for the third wave. In Delhi, the Chief Minister's office said it plans to double the capacity of oxygen plants in hospitals by the end of September. It is also ramping up infrastructure in accordance to a worst-case scenario where Delhi would have to handle 45,000 new cases per day. This is prudent since alarms were raised after huge crowds were seen in the capital's markets and malls just days after COVID-19 restrictions were relaxed. This even after the city's health infrastructure was brought to its knees during the second wave of COVID-19 in the months of April and May. At the peak of its second wave, India reported over 400,000 new cases daily, along with shortage of vaccines, medicines, oxygen, hospital beds. Over 380,000 people have died so far. Meanwhile, the World Health Organization's chief scientist has said the Delta variant of the coronavirus, which was first identified in India, is fast becoming the dominant variant globally due to its increased transmissibility.
Situation is so dynamic because of the variants that are now circulating, and as you said, the Delta variant is well on its way to becoming the dominant variant globally because of its significantly increased transmissibility. We need more data, again, from well-designed studies on the efficacy of the different vaccines that are in use in different countries against the different variants.
WION now available in your country. Download the app now. Get all the news on the move.